Good morning. I'm Dr. Mark Stoller, and I'd like to welcome you to Conversations in Primary Care, the role of diet and lifestyle in the management of diabetes, making it work for you and your patient. Joining me today is Davida Kruger, nurse practitioner extraordinaire from Henry Ford Health Systems in Detroit. Welcome, Davida.
Thanks for having me.
My pleasure. And today we're going to have a discussion, and truly a discussion, on how to effectively manage your patients with diabetes beyond pharmacotherapy. So we've solved diet and exercise. That's taken care of. But I think medication adherence has so many different variables. And one of the issues that I have with the guidelines on how to manage diabetes is it's just metformin is the cornerstone of therapy. But what's your experience with adherence to metformin among your patients?
Well, first of all, I see too often that metformin is started 2,000 milligrams a day, and the patient has raging diarrhea. They come back, they've either stopped it or they're miserable. And so I think we need to understand the side effects of metformin, which is a lot of GI symptoms. I think it has some great benefit to our patients, but you have to, again, go low, go slow. Start with 500 milligrams. Go to 1,000 a week later. If the patient has GI symptoms, go back to the place they didn't have any GI symptoms and use the maximum dose that's comfortable for the patient. But I always have, it doesn't matter what medication I pick, and I think metformin is a good cornerstone. If we pick medications that cause hypoglycemia and weight gain, we've lost the battle. Because we're telling them, stop eating, go get physical, and then we give them medications that cause weight gain. So we know metformin's not going to do that. So that's not a bad choice for the start. But we also have to work with the side effects. So I talk to the patients and say, if there's side effects, don't stop it. Call me. Let's see if we can work through. And I think acknowledging that there's potential side effects and that you're willing to help them through those side effects helps with adherence.
And 30% of patients who are on metformin have GI side effects.
Absolutely.
So I think that's an important question to ask.
Absolutely.
Because patients will often go, I've been having this diarrhea for 3 months. I didn't tell you about it, but it's ongoing. Well, it's from the metformin likely. And so I think that's an important question to build into follow-up visits. How do you deal with the side effects that patients hear about on TV, or their helpful pharmacy gives them the printout with all the potential adverse effects? How do you handle that in a diplomatic way? Because primary care providers have to hear this all the time and get very frustrated. What's the best way to discuss that issue?
Well, I think you have to be upfront and acknowledge the potential risks, but I also think you have to say, look, anything we do, anything we eat, anything we take, all medications are going to have a potential side effect. And I talk to them about research. Since I do some research as well, I talk to them about the fact of how we report adverse events. If you have a cold, I have to report it. If you break a leg, I have to report it. All these things get reported. So let's cull down what potentially could be a real risk for you and talk about that.
And I think that although it's one more thing for a primary care provider to have to know, but just kind of knowing, well, how frequent are they? So yes, if there's a risk of bladder cancer, but it's 2 cases per 10,000, patients need to know that to then make a better decision. We can't fix the cost issue, but how do you deal with this with your patients?
So first of all, you have to pick medication. We, as healthcare providers, we're not making the high-level choices anymore. It's culled down again to this is what this insurance company will pay for, and picking from that list potentially, because I think with all of the new medications, and I think we all have to be savvy on the new medications because there are so many benefits to our patients, picking what's on formulary and going with that. And we talk about coupons and the benefit of the medication, what's a copay, what can you afford? Because if a patient goes and they get shell shock because their copay is $100 or $200 and they don't pick up the medication, again, we've lost all this time. So that's another conversation. I believe this is covered. I believe it's a manageable copay. I can give you some copay cards. I can give you samples to start. But if you get to a pharmacy and there's a problem, call me.
And many patients are reluctant to call. And I think so many of our newer therapies, which are great and really advances in how we can treat patients safely, the cost barrier often leads to patients not initiating. And I think that's a key way of dealing with this. So let me close with a perfect world question. So in a perfect world, and obviously we don't live in a perfect world these days, how would you design a treatment strategy for a newly diagnosed patient with diabetes from the lifestyle side? what would be the perfect structure in your mind if you had your way?
Yeah, I think for it to be perfect, most patients have gotten to diabetes because of a sedentary lifestyle, because of some hereditariness, as well as they're overweight. They're not happy about that either. That's not where they want to be. So in a perfect world, we'd work out a structure that works with their lifestyle so they could be more physically active, so they could eat better, and so we have some weight reduction. And I'm not talking 100 pounds over 20 days. I'm talking something reasonable, like a couple pounds a month, that again is sustainable. So I really think our medications are amazing today, but the key is a better lifestyle, more activity, better food choices, some weight reduction. I think that's where we have to head. I think we probably have to head that way as pre-diabetes as well, but you and I are probably seeing patients that already have diabetes, and so I think that in a perfect world is helping them fit it into their lifestyle. And here's the key too. If you have one family member, you probably have other family members that can benefit by more physical activity, better nutrition, healthier eating, and so the whole family will benefit.
And the key number for patients to know is 16 pounds. So if you have fatty liver and you lose 16 pounds, you can reverse those changes. And if you reverse that, then you're really having a significant impact on insulin resistance and beta cell function. So I often give my patients that 16-pound target. Let me ask the same question from the established but not controlled patient, because they're even more difficult. Okay, you've got a blank slate with a new patient, they're motivated, I don't like being diabetic. What do you do, and what's the perfect approach to the patient who's had their diabetes for 8 years and isn't controlled?
I think you have to find the hook. You have to figure out what they haven't heard, because we teach and it's not always heard, or it can't be incorporated in their lifestyle. And I always think that if I'm still there, the right moment will come and I can then help that patient. So, for the patient who hasn't been there for 8 years, why haven't they been able to achieve the goals that they've set out? Not necessarily I've set out, but they've set out. So I think you have to find the hook, and you have to find out what's going on in their life that has kept them from being successful, and try to motivate them into that direction.
That's just such a key point, because most primary care providers have longitudinal relationships with their patients. And so it's, what's the hook? Just staring them in the eye and going, if you can stare them in the eye because you're not looking at your computer screen,
yes.
what's preventing you from being successful? I know you want your diabetes controlled.
Absolutely.
I want your diabetes controlled. What's in the way? Let's talk about what's in the way, because if you can find the hook, I think you can be really successful. So that's so beautifully stated. So, Davida, we've now made it possible for everyone watching this program to successfully implement lifestyle modification. I think that physical activity still remains important, but it all gets down to what's going in, because the pancreas has to process carbohydrate. We have to make it, our patients make it easier on their own bodies, and so I think that one without the other just isn't going to be successful. I want to thank you for joining us today.
Thank you for having me.
It's our pleasure, and I want to thank everyone who's attended today's program. Have a great day.